I'm Dr. Pedja Stojicic. Welcome to Healthy Climate America. I'm a physician and a longtime community organizer. And I'm excited to guest host the next two episodes in our series on climate and health community organizing. It's great to be here. This summer, I helped launch a new organizing training program, the Global Community Organizing and Advocacy for Climate and Health Scholars Program. We received 700 applications from teams of clinicians worldwide. What we are seeing is an explosion of interest among health professionals as they increasingly recognize that responding to climate change is critical to improving the health of their patients and our planet. They know something is wrong and they want to be part of the solution. I'm delighted to be joined by Shweta Narayan, a campaign lead at the Global Climate and Health Alliance and a longtime colleague of mine. Based in India, Shweta has over 2 decades of experience in advocacy and community organizing. She had led campaigns to limit fossil fuel and air pollution and to promote climate justice and health equity. In our conversation, Shweta will discuss her journey into community organizing, the increasing role of health voices in climate advocacy, and what inspires her as she looks ahead. Shweta, welcome and thank you for joining me. I want to start with a question that is just I know it's highly relevant for you because it's been hot off press. The Global Climate and Health Alliance released a report on health impacts of fossil fuels from cradle to grave. Can you tell us a little bit about the report? And then also, how could health professionals organize around it to push for change?
Yes, indeed, Pedja, and thank you for that question. So it's important to, as health community, and this is the practice in the health community, that if you want to really challenge a problem, you have to address the root causes. And fossil fuels linked to causing and exacerbating the climate crisis that we're facing collectively. So the entire life cycle of fossil fuels, exploration, extraction, refining, production, combustion, use, and disposal, the entire life cycle has health harms associated with it, right? And then parallelly, what we did was looked at the human life cycle. It's like at what stage of human life do people get most affected? And we discovered that every stage of human life cycle is affected by fossil harms. But we also, for the first time, looked the social and economic model of the fossil fuel industry because their behavior has a global health implication. And for health professionals to be able to address some of the health issues, 80% of health is outside of hospitals, right?
Yeah.
So you have to look at the circumstances, be able to address some of the social side of harm. And what we saw was the social economic model of fossil fuel industry led to marginalization, more impoverishment in communities, substance abuse, violence, trafficking, gender-based violence. The list continues. I go on forever. The amount of evidence.
Yeah.
We've looked at the entire scale and scope of the harms. Reason just to connect to your question that you asked, how can health professionals use this report? Unless you know the scope of the problem you're dealing with, you will not design your solutions. This effort in putting this report together was to present the scope of the problem, to be able to then figure out what are the ways in which community can intervene towards solutions.
It speaks really, importantly, why this work for health professionals should not be we just going to be healers within our clinics, but we do have responsibility to step out of the clinics and really think about, as you were saying, what other aspects of human life are affected by the societal arrangements that we have and some particular things that we are doing as humans to each other in a way. But I mentioned that you have a long experience in community organizing. So take us back to the beginning of your journey. How did you get involved and what was the story behind your first kind of community organizing effort, if you want to put it that way?
I think part of it was designed, and part of it was an accident. Let's put it that way. So I've been social work, and I specialize in psychology and correctional administration. As part of my degree, I did a thesis on environmental regulations and its implication on society. And that experience itself was quite interesting because, I mean, as I said, I'm a trained social worker. My specialization is in social sciences, and I was examining some of the environmental laws and implementation and government regulations from a social science perspective, like who bears the cost, who benefits, what are the social outcomes of environmental regulations. And immediately after my graduation, I started working with an environmental and human rights group in Bombay. And as part of that group, I volunteered to help support the survivors of the Bhopal gas disaster, the 1984 Bhopal gas disaster, who were at that, this is 2002, and they were organizing a photo exhibition as part of the 18th anniversary of the Bhopal disaster in 2002 in Bombay. So I volunteered to help support the survivors, a few events, organize a few protests, because so Bhopal, I mean, I don't know how many of the audience would know about the Bhopal gas disaster, but this is called the worst industrial disaster in history. And it's not just the people who were exposed to gas. The second and the generation is also affected, and severe issues of cancers, birth defect in the second and third generation. And in the discovery about the disaster, we found out that there were extreme malpractices that companies had engaged in during its operations in India, and shut down its business overnight and fled. It's still not been brought to justice. And it was later acquired by another chemical corporation, Dow Chemicals. Dow Chemicals headquarters in India was in Bombay. So I was involved in supporting the survivors to organize full gatherings outside the office demanding accountability. So that was my first brush into, I would not organizing, but more in lending solidarity. I have always seen my work as lending solidarity. Through the process of lending solidarity, I've helped communities who have been organizing to strengthen their organizing movement.
Thank you for that, and that's a beautiful story. And I especially like the frame of lending solidarity because organizing work in many cases is not just stepping in front of the people and saying like I'm your leader, but actually the opposite is enabling others to find their common purpose and be in solidarity with others to do that. So speaking of organizing, both you and I are working on a program called Coach, where we are trying to invite and train health professionals to join us on this journey of community organizing or lending solidarity, as you were saying. And we have an explosion of energy because we got like a lot of applications for this program. Just for the audience, we launched the application and we have 10 spots for the fellowship and we have over 700 applications. I wanted to ask you, like, what is your interpretation? Where's that interest coming from?
I think there are a couple of things that have contributed into this. I mean, of course, there's no doubt that there is a hunger, there is a need in the health community to understand more about how the health community can organize and be effective climate advocates. But there are a couple of other things that I feel are also equally important. One is severity of the climate chaos that we are seeing. The compounding effect, repeat after repeat, different kind of extreme weather event, climate induced, that are battering communities around the world. We barely recovered in India, for example, barely recovered from the heat wave, and then we have been battered by floods. We are seeing this repeat nature and more intense nature of the events. And this particularly is important because health is at the forefront of this climate crisis. When people are injured, they need health services. The health systems are overburdened with the need to address the fallout of the extreme weather events, the fallout of these crises. So there is definitely a realization in the clinic of the severity and the seriousness of the problem before us. So that's one thing. The second thing I feel is what is compelling health community members to to explore ways of strengthening their own skills in organizing and in advocacy is because of the failure of our leaders. The science is clear. What needs to be done is quite evident, but the political will is missing. The climate crisis is not going to wait for the political will to show up to the challenge. So somebody else has to step in. And the health community has, interestingly, a very rich history of stepping up and taking action and shaping the society, shaping the surroundings where we live in. So I think they're doing that, and they're looking for ways to strengthen their capacity. And coach fellowship happened during that time, and that's why I feel that there is such an overwhelming and humbling response that we are seeing.
Yeah. Sometimes we have to really acknowledge that the right moment matters sometimes much more than whatever programming you can create. But it's one thing to train people. The other thing is to see the translation of these capacity building efforts into practice. So, can you give us an example where clinicians turn these trainings and organizing skills into reality and collaborated to create solutions?
This is important, as you said. There's one thing to understand the theory, but when you put that into practice, there are always surprises, and there are always these questions of okay, how do we get to the solutions part of it? One example that comes to my mind is from this amazing group in India. I mean, I'm giving an example of India for two reasons. One is whether I'm proud to be associated with this group, and this group is called Doctors for Clean Air, and also because it takes on the very real challenge of air pollution in India from a health lens. So Doctors for Clean Air basically works with health professionals, as the name suggests, doctors primarily, and nurses in many places, in building their capacity to understand the root causes of air pollution, the impacts of air pollution, and so that the doctors then can go back, advocate for better clean air policies, to advise their patients. This organization has done a tremendous piece of work in Western India specifically, and in Western India, because a lot of air pollution often is seasonal during the crop burning season. And that not only becomes a problem for the immediate geography, but it also, because of the transboundary nature of the problem, cities get affected outside those state bounds. And there are champion doctors right now working with farmers who are working with local administration, and they have built their capacity, understood the health impacts of air pollution, understood the root causes, and then they have taken that skill, are advocating for care practices for their patients, but all working with farmers, convincing them to not engage in crop working and look at alternative healthy solutions. As a result of which, in one particular state, there are now districts, that are burn free.
Wow.
The farmers have, with the health argument, with the trusted advocacy of the health professionals, the farmers have shared ways of crop pattern that they don't burn crop, and therefore they don't contribute to air pollution.
Yeah, I love that example, Shweta, because it speaks also not just about finding a solution to a problem, but how that solution was depending on the ability of health professionals to develop a relationship with farmers, to cultivate the relationship, to create trust. So much so that they started changing their practices. Which, if you're any kind of professional, you know how difficult it is to change something that is an inherent practice that you've been doing for ages, or even your ancestors were doing in some certain way. So amazing work. Along the same line, and especially in this context of, relationship building is one of the skills that we're teaching as part of the organizing effort. What are the other things that you think every health professional interested in this, what else should they put under their belt to engage?
There are a couple of things that comes to my mind in my experience working with doctors, nurses. There is a real challenge in terms of like how overburdened their schedules are and how they are sort of like so focused on the hospital and hospital-related care that there seems to be a connect between curing the patients in the hospital and not inquiring why those diseases are happening. And so, little bit of going back to the preventative aspect of healing and also on curative aspect would be very helpful. I think the trust inherently comes in this profession, but extending that trust into other community members who might not be, like in this case that I just talked about, the farmers, and you leveraging that trust to convince solutions that can be beneficial through a health lens. I feel humility is very important. Doctors, of course, are trained and have the knowledge of the health impacts and the wherewithal of treat illnesses. But there are all other lessons that you could learn from outside that can strengthen your perspective, and that comes with humility. And that's very, very important. There is a structure outside. There is a governance structure, there is a community structure, a societal structure, and just respecting that, even while challenging it, it requires a trust.
And I was thinking about, you and I recently did a couple of sessions on narrative and storytelling. And part of the challenge, as we witnessed, both of us, was how do we actually create spaces where health professionals not share just the stories of their patients, but their own stories. Because that's how you actually materialize humility. That's how you show I'm also vulnerable. I'm also affected by this. It's not something that, I just observe as a scientist or as a clinician, but it's kind of like cutting through the bones of our own existence. And that's why, and communicating that to communities, I think shifts the whole perspective of that relationship and whatnot. And I'm glad that you're naming that, because I think that's really critical. And last question, and I would try to ask this question not to sound too cheesy, because it's a usual question, like, where do you find hope? So where is for you that intersection of working with clinicians, working with health professionals, with public health leaders, and hope? So is there anything specific within that intersection that gives you hope that that doom and gloom can be changed, and that we have a different, much more hopeful vision to look for in the future?
I'll tell you something. Every time I've been posed with this question, I'm like always puzzled, and I have a puzzled look in my face, because I'm an eternal optimist. No room for being cynical. I try very hard not to be cynical. Yes, there is a lot of ends that points to doom and gloom, but the fact that we have no other choice, we're fighting for survival, we have no other choice but to fight, hopeful itself. We've not enough. We'll give up. And that's hope. I see hope in every, it's just the nature of my being, but the fact that for 10 spots and announcing in many sessions and webinars that we did around coach that there were 10 spots, we still got 700 applications, over 700 applications. People were hopeful, and that is hope. I'm not trying to the issue of hope, but we are coming together either silently or however we're coming together with the resolve to fight and win is hope by itself. We have no other choice. Let's put it that way.
Yeah. Shweta, connecting hope with choice is a beautiful way to end this conversation. Thank you so much. And thank you for choosing to spend the time in this conversation. And I know it's going to inspire a lot of people around the world to actually engage in this work in the future. So thank you so much.
Thank you much, Pedja. Thank you so much for thinking of me and having me here. It's absolute honor and pleasure. It's always so good to talk to you.
That's it for this episode of Healthy Climate America. We hope you'll take what you learned and share it with colleagues and friends. Our work also wouldn't be possible without our members and donors. If you enjoyed listening, please go to ms2ch.org and click on Become a Member to join our community. Healthy Climate America is produced by Savannah Martinsik. Our podcast consultant is Julie Hantman. Our podcast intern is Isaias Segi. Our music was composed by James Harp.